I'm here today for a Q&A with Dr. Bob Corish, world-leading medical expert on astaxanthin, and we are going to discuss cardiac care. What are some of the things we should be concerned about in terms of heart health?
Well, heart disease remains the #1 killer in the developed world, and it depends upon your genes, your lifestyle choices, your diet, your lack of activity and stress levels. But in reality, we're all at some risk of some degree of heart disease.
How do free radicals and oxidation contribute?
Well, science has already shown that free radicals are the major cause of heart disease. Free radicals are chaotic molecules that initiate the injury to the arteries, which leads to inflammation, which leads to heart disease. Free radicals also cause the oxidation of LDL cholesterol, which is considered the bad cholesterol, which leads to inflammation and leads to heart disease. So it all begins with free radicals.
What is a free radical?
Well, that's a very difficult question, but a free radical is a toxic, chaotic, unstable molecule that attacks cellular structures. When it attacks these cellular structures, which could be the DNA, which is your genetic material, the cell membrane, or the proteins in that cell, we have a breakdown of the cell. And if you think about cells as they join together, they make tissues, tissues makes organs. So free radicals are these molecules that actually inflict all the disease processes that we can think about in medicine. A free radical, when it causes this damage, we call it oxidation. So therefore, the answer to this oxidation is an antioxidant. And when we talk about antioxidants, we think about vitamin C, resveratrol, but astaxanthin is the most powerful antioxidant that we know of in nature at this time.
Where do free radicals come from?
Well, free radicals are normal in nature, so they can be generated from the sunlight. The ultraviolet rays from the sunlight generate massive amounts of free radicals. Toxins, herbicides, our foods contain free radicals. Even our own metabolism generates free radicals. So they really are a normal part of life. The problem is that once these free radicals become much greater than our ability to neutralize them, then we see problems.
What does the research tell us about how astaxanthin supports cardiac function?
Well, astaxanthin can support healthy cardiovascular function. And one particular beneficial aspect of astaxanthin is that it has been shown to stop the oxidation of LDL cholesterol, which is also known as the bad cholesterol. Now, in and of itself, the LDL cholesterol, the bad cholesterol, is not harmful at all. But once it becomes oxidized or it becomes rancid, it sets off a whole chain reaction which includes inflammation and leads to heart disease. Astaxanthin can stop this very first step, therefore prevent this chain reaction, and we can avoid some cardiac problems in the future.
Anything else?
Some of the things that astaxanthin has been shown to do is it maintains the flexibility and distensibility of the blood vessels, especially the arteries. And when we consider that the arteries are very important for the blood flow to the heart, astaxanthin can play an important supporting role here.
As well as astaxanthin, research tells us there are other powerful ingredients known to support cardiac health. What are these ingredients?
Besides astaxanthin, there are some other nutritional compounds that have demonstrated beneficial cardiac properties. These include omega-3 fatty acids, which have been shown to lower triglycerides, coenzyme Q10, which has been shown to be a very important catalyst in energy production, especially in the heart, and vitamin D3, which over the last decade has shown it has some profound health effects on the heart and improve their cardiac performance.
Are there any medical interactions or contraindications that people need to be aware of?
Well, as far as we know, none of these ingredients have any contraindications with cardiac medications or other types of medicines. But as we always tell people, please check with your healthcare provider before you begin any supplements. And at the same time, nobody should stop taking their current medication or alter their regimen until they check with their doctor.